Welcome back. Now, up until pretty recently, when we thought about plastic surgery, we probably pictured Michael Jackson and the more extreme elements of showbiz in the US. But in the last few years, cosmetic surgery has really taken off in Ireland, and nowadays it seems like no big deal.
It is still often a major operation, though, and some doctors are concerned the risks are being underplayed. Join us today to discuss our talking point, cosmetic surgery, is it worth the risk? We're joined by Dr. Patrick Treacy of the Aylesbury Clinic, journalist Antonia Leslie, who's had a number of procedures, and Marie Loftus from the cosmetic surgery magazine Rejuvenate. You're all very welcome.
And I'm with Susan Daly, columnist with the Irish Daily Star, and I'll also be getting your calls and comments from home.
Patrick, if I can come to you first. Obviously, Kanye West's mother dying shortly after her cosmetic surgery has made the headlines recently, and it brings the whole thing back into focus again. They obviously are able to afford the very best in care out there. How common is it for something to go as badly wrong as it did here?
Okay, it's a very good question. The mortality rate from general anaesthesia is 1 in 5,000. In cosmetic surgery, it's better than that, because in ordinary surgery, obviously you're bringing in people from road traffic accidents, cancer cases. In cosmetic surgery, the sort of things that tend to tip the balance are, number one, people having procedures like she had done. The first thing is an abdominoplasty or tummy tuck. Inherently, these people are fatter. They sort of are at surgical risk of high blood pressure. And knowing her ethnic background, most probably she had diabetes on board as well. I've certainly worked in the United States with people of that ethnic background where we'd have commonly cardiac arrest without any surgery. Now, you add into that the fact that she had a second procedure done. I think it was a blepharoplasty, so you're increasing your duration.
What's blepharoplasty for people?
Sorry, she had a breast reduction, didn't she? I think it was,
that's what it was.
So two big procedures back to back at the one time. You're increasing your surgical risk dramatically, because
so
the normal procedure time...
Why was she allowed to go ahead with that, with all the factors that you're talking about? Why was she allowed to continue to have two procedures like that? Yeah,
it would... I would query that myself. Certainly, probably her operation time may have been as high as 8 hours with somebody that is obviously overweight as well. So, I don't know. It may be the fact that surgeons have done it before and got away with it, and they sort of, you know, are less afraid of doing it than somebody that may have had their hands burnt before. But it would seem to me to be an inherently much higher risk.
What you're talking about there, surgeons doing it before and getting away with it. There is a lot of fear out there about people not being regulated, particularly in this country, that you don't know who you're getting when you go to a surgeon, or you're interested in maybe in having a procedure done. Do you feel that's a problem?
Absolutely. In Great Britain and Ireland, I mean, particularly in Ireland, the lack of regulation is abysmal. I mean, really,
what would you be looking for? What would be the ideal?
Okay, what we need is a couple of things. Immediately, the Irish government should set up a commission for safety and quality of healthcare. We should look at all establishments that's providing either cosmetic surgery or non-cosmetic procedures, and we have to sort of look at them in such a way that they have to evaluate staffing levels, they have to evaluate support services, they have to evaluate what sort of equipment they have. As well as that, this commission should have the power to inspect all the places, not only regulate
none of that
them,
happens
but
at the moment.
Nothing happens. We should have a kite-marked single or sort of little symbol, like the Healthcare Commission in the United States of quality control, that goes onto every advertisement, so a patient knows beforehand whether it has passed government procedures or not. And also, the last thing, which is almost the more important, this commission should have the power to take away people's licenses or their registration. I mean, this is basic in every other country. I mean,
sure.
I'm not. There's other reasons why it hasn't happened.
Why is plastic surgery being treated differently to other surgery than in this country? We're hearing so much about this, recently a survey about people arriving in who've had surgery abroad, people with botched jobs being done, having to go to the likes of yourself to get stuff fixed. Okay, well, this is the result of a survey done by the British Association of Plastic Surgeons that Rajiv Grover sort of released last Friday. And it shows that of BAPS members, 80% have treated 1 to 3 patients from overseas for retreatment. 38% have treated 2 to 5 patients, and 14% have treated more than 9 patients. There's many reasons for this. I mean, the first thing is people that probably can't afford procedures in this country tend to go overseas, and as a consequence may cut short the recovery time. Some of them are coming back to Ireland or Britain just to get their stitches out after facelift procedures. And obviously, if they're going as far away as South Africa, they increase the risks of having deep vein thrombosis, which is a risk anyway post-surgery.